I'm a physiotherapist, and I thought what would add a little value to our conversation this evening is a real clinician perspective on why this stuff matters, why we care about privacy, and how we kind of put that into the clinical thinking. And I think this is probably most useful for those technologists, for those people that maybe have never treated a patient or have never had someone come to them with their life. So I hope I can give you that perspective on what we're talking about this evening. So why do we care about this? What is important about maintaining privacy and security for our clinical records? I think the key thing that it comes down to is trust. So actually having a clinical conversation, having someone come to you and basically bringing their life to you. You're asking them, not just about their physical signs and their physical symptoms and what's going on, but also there's an undertone of how they live their life and the decisions that they make around how they live. And building that trust relationship with a patient is, it's a clinical skill, but it's also, that rapport is something that you can't take lightly. And if you lose that rapport, and it can happen for many different reasons, what you lose then is the ability to help someone. And if we lose the ability to help someone, then we actually don't have there is no clinical interaction left. There is nothing that we can do. We're not doing our job. So when that comes back to thinking about trust and about confidence, when we're asking people to tell us about their lives and about how they live and the decisions that they've made, well, it's up to us then to record them in some meaningful form. That's part of what we do as our clinical interaction. And when we start to record people's lives and people's stories, the human history is told in the narrative. When we do that, that's when, things that people wouldn't be comfortable having in the public domain, in the public sphere, or for a third party to chance upon or find out if there had been a security breach. That's when we run into some dangerous territory. So if we think back to our Hippocratic oath, that medicine should do no harm, then when we collect data, when we collect numbers, when we collect people's experiences of life as it relates to their health, as it relates to their well-being, as it relates to their ability to change how they live, if that then goes into the wrong hands, we have done harm. Because what then happens if somebody who may have had, so even something in the past, something like a drug test, or that it had a sensitive disease. There's lots of diseases that have stigma around them, particularly when we talk about mental health. Things like that then have decisions made around them in terms of employment. There's also the shame that goes with, for people, that goes with having maybe a chronic disease or a mental health issue or a myriad of other things. So if we can't keep that data that people trust us with, if we can't keep that safe and be able to use that in a meaningful way, we have in fact done harm. And I think that's an important thing to consider, because we have to consider that we are there for our patients. So behind me you'll see e-patient Dave. Now I was lucky enough to meet e-patient Dave in my latest travels. So Dave de Bronkart was a cancer patient, and he is now sort of the figurehead of the e-patient movement. Now when I first chanced upon this, I'm Australian, I didn't know what e-patients were, but they're engaged patients. They are patients that take a greater proactive role in gathering information, in helping out their, sort of presenting that information then to the clinicians that they work with. And Dave's big catchphrase is, "Give me my damn data." So maybe Australians yet aren't so quick on the uptake around, Australian patients aren't so quick on the uptake of collecting this data, but from a clinician and a patient interaction perspective, I thought it was worth mentioning that even though these patients trust us with their data, they also want to have it for themselves. Now, we're not going to talk today in any detail about our patient-controlled e-health record, because we could be here all evening with some pros and cons around that particular issue. But I think to know that we can't forget that as much as we are there to be able to help a patient make decisions, we're also there to partner with them. And data is what drives decision making. So from a clinical perspective, don't ever forget that you've got to keep it safe, but keep it safe and allow them to access it in the way that they want to. I've also, while I'm talking about what I did on my travels recently, I also met the Society for Participatory Medicine. I'll put these links up on the website so that you can see them. But again, just pointing to the fact that there is this greater patient engagement movement. Now, we don't have a chapter of that here yet, but I do think we have to find ways to bring more patients into this data collection framework, allow them to contribute, and then also allow them to take their data, to share their data with the people they want to share it with. But above all, our job is to keep it safe. So it's lucky that I don't sleep very well, because this was really good because it put me to sleep. This is actually, I'm sure Pat might cover this in a bit more detail, is the National Health and Medical Research Council's guidelines around collection of data. So this is what I have to consider as a clinician in terms of, well, why do I care about this? As a clinician, what matters to me is that my medico-legal records are safe. So I love my clients, but I also don't want to get sued. So I have to make sure that whatever data collection record or capability I use protects me, and it's sort of records, by the definition in the National Health and Medical Research Council, are not just documents or databases, but also consider that they're photos. So photos and visual things. So as we start to collect more patient records in a visual way, a big problem that we find is that clinicians themselves will use their own smartphone. Now that's that's a huge risk in terms of keeping a patient's data in your own device. Or if you use theirs, alternatively, you then lose that medico-legal record. So that's a key consideration. Once I've covered myself from a data protection perspective, then I want to be able to collect enough information to know what I did. So I've got to be able to base my decision making around, well, what did I do with that patient? What worked? What were the outcomes? What do I need to do next? What are they expecting of me? And after that, I come back to keeping trust with that patient. And again, that comes above all things. So if I can stay safe, they can stay safe and happy, and the clinical interaction can be effective, then we're well covered from a clinical point of view. I thought I might get some discussion with you here, guys, about what are the actual barriers to change. So in my own thinking, I was thinking, well, in terms of adopting new data collection models and methods and electronic health records, because this is a thing that comes up again and again, is that I build this thing and doctors won't use it, or medical professionals won't use it. And I think a key thing comes here is to, again, if we think about trust, is the opposite side of that is that we're risk averse, is that we are trained to, again, do no harm. We don't necessarily want to put data on the cloud if you can't prove to us that that cloud is not going to get hacked. We are not prepared to sacrifice that trust that we have developed over time and that changes people's lives for a new data collection tool. It comes back as well to time and to workflow. So and I'm sure clinicians in the room here or down in Melbourne will know that we don't have a lot of time. And the time that we do have in a clinical scenario has to be best used to interact with, with that patient. So if you're going to make something new around data collection or a new way of accessing that, please don't make it something that's hard for us to use. It has to be significantly easier. It has to be significantly more accessible and make our job a lot easier. Otherwise, we might just stick with our paper records. I'm sorry to say that. I wondered if there were any other barriers to change that the group might have in the back of their mind around why we don't actually take on new technology in health. It's a big thing that's talked about. Any ideas?
Perhaps. I'm just interested that the most important thing for you is the trust the patient. I think the most important thing is the cure of the patient or the health and well-being of the patient. And often, I work in the data industry. I get to see how data is siloed across a variety of industries. It's very heavily siloed in the medical industry because of these concerns about security. And I do wonder sometimes whether the barriers that are created that are some pilots and the attitudes about the sanctification programs or that kind of stuff might in fact be a barrier to giving you a little bit more information between silos and getting some of the benefits from analytics and analysis that some programs.
So say for example, a really good point there is that we do have so many of these bits that don't talk to each other within the health system. Right. Okay. I think you touched on an interesting point with that in terms of saying that I said that trust is the most important thing, but aren't health and well-being outcomes the most important thing? Without the trust, you don't get the health and well-being outcomes. But in terms of being able to access the data for the analytics perspective and for future-driven initiatives, and I think that is an important thing.
Yeah, because I mean, it's very difficult to find to do good epidemiological studies across populations without being able to match information, right? Sources.
Yes.
Very, very
Absolutely. Was there anything else that might be a barrier? Having other combinations that might be
verification? I think particularly hospital doctors are affected by that. What's released, say for example, best practice guidelines, patient can go wrong. That's true.
Absolutely. Fear of litigation is massive. Okay.
There's possible costs of transferring existing data. Things are regulated.
Yeah.
Costs of old practices.
Absolutely.
It's really significant. So unless you target new ones, it's probably going to be adapted to new ones. So cost of conversion.
Yeah, cost of converting data from paper records is an enormous consideration. So thank you for that. Just moving on, what we're thinking about actually looking, if you're researching this yourself, because I had to do a bit of research. I mean, I know what I do as a clinician, but I don't necessarily, I'm certainly not a data expert. You might come across HIPAA, and I know that Pat will talk about HIPAA in a little more detail. HIPAA is simply America's version of Australia's health regulations. So it's there as a framework, it's there to certify different things that are used within health tech. It's worth talking about for the fact that to be HIPAA compliant, which anything that's used in the US has to be from a healthcare perspective, HIPAA compliance requires that a business associate agreement has to be signed. And up until September this year, that wasn't happening. So big companies like Google, like Amazon, had no impetus to sign something like this. So it meant that health startups weren't actually able to access them as vendor services. The change to the law made those vendors have to be responsible for the data that came through their streams. So they were because they had to be responsible, they were then much happier to sign those agreements, which now means that from a startup perspective, whether we are just in Australia or more globally, we can access better security through those big vendors, which I'm sure is something that Pat will cover off. But I thought I'd also mention mobile app rulings. So FDA, TGA, CE, these are global groups that have to so the mobile app rulings. Basically, we had to look at risk. So from a perspective of, is a mobile app a medical device? So even now the laws are really quite broad in terms of defining this. But what I want, just in terms of understanding, if you're making something, do you need to get some kind of approval or certification? They can be stratified into low risk, medium risk, or high risk things. So it's worth as you research what you're doing, just looking at the risk profile of the apps that you're trying to create. So is it actually a medical device? Is it actually going to be used to make a clinical decision? So that, I hope, has given you just a little bit of a clinical perspective on what it is that we as clinicians have to think about when we treat a patient, and then how we approach the data collection, and why it's important for us to consider how secure that will be.
All right, so just so I get a bit of a handle on it. So what I'm going to talk a little bit about is from a security vendor's perspective, what to look for, how to protect yourself. It's a really simple things to do. They're not necessarily about my product. It's easy ways for organizations, both large and small, to keep an eye out for potential breach of data and what to do to prevent that and what to get that stuff. So just as a point of interest, the normal doesn't participate as well. Who looks after, or who has in their custody, individually identifiable patient data? Just by show of hands. So a few people. Who's running like a startup organization or trying to get a product out? All groups as well. Who is working in health services as a professional health service person? And who doesn't want to put in their hand up? I should ask the opposite way around and get an affirmative with the hand down, like a whole room of saying yes. The reality is, everything is going electronic. Patient records are going electronic. You see a lot of people who are still on paper-based, but the inevitable is happening, right? So we know that's happening. Near me to tell you that. That's just where the industry's going. More and more, people want to interact via the internet. They want to know that if data is easily accessible, you need to be able to spread data around between your partner organizations, other people in the chain, healthcare, and the patients themselves. So people create an electronic record, they create a trail. There is a lot of responsibility placed on anyone who deals with that data to take care of that private data. Now, if you're running your own company, and if you're starting up, at the same time, you've got a whole body of regulatory requirements requiring you to look after patient data, but you're probably fairly keen to protect your own data as well. It's a very important, if I've got a great idea, I'm taking that out there, but it's just a concept, not technology. I don't really want someone else with a bigger budget and lots of technology behind them to be able to take my concept and get ahead of me, right? Your intellectual property is something that's very important as well. So, before you start looking at data in its electronic form, you kind of need to think back and think, what did I used to do with data in the paper form? So, anyone who's ever been to the hospital, to the GP, to the physio, wherever they've been, someone who's using paper records, those records aren't lying in a big bucket in the reception area for anyone to just rifle through them. We didn't really need a big handbook to tell us that it wouldn't be a good idea to have a bucket of unsorted papers there, that while I was waiting for my appointment, I could see something really interesting. I never knew the Sandy had this, but And here's her credit card number and address. Fantastic stuff. So that's obvious. Most people didn't need a 20-page policy booklet telling them don't leave a bucket of data lying around. Now, there are so many different ways to connect to that data, and so many different ways to connect to different sets of data. It's really, really critical to understand everywhere the data could be, and to have a policy that covers what you do with data, where it's allowed to go, where it's replicated, in every part of that data lifecycle, right through to destruction. It's something that not a lot of people think about. So everything's got a life. What happens at the end of the life? And we see over the years, before we started electronicizing all the stuff, that's what we call it, people were dumping paper records in a landfill, and that was how data breaches were happening. I could pick up filing cabinets full of old patient records, and suddenly I've got personally identifiable data. Now, it's so much easier because there could be so many more copies of data all over the place that I don't really know about. Once the data is copied, how do I understand that it's copied? How do I understand where it is? How do I understand who's doing what with it? It's really, really critical. So before I talk about information security, how to protect all that stuff, the thing I say to anyone who comes to us, we get a lot of people say, oh, we need to put some technology in place, we need to buy some stuff to protect my data. We always say, you need a policy first. You need a really strong policy. The policy needs to be written by a lawyer, vetted by an IT guy, and then someone who can speak fluent English that isn't lawyerese or ITEs, needs to write a 2-page summary that anyone in your organization can understand. Because it's great to have 100 pages of rhetoric, but if no one understands what it means, it's useless. So policy is the most critical thing. No policy, no technology can save you, no cabinet lock can help you, because unless you know where everything is, you've got a policy to manage it, everything else is useless. So beyond that, I can't have a policy. You need a lawyer or an IT guy who understands the process to have a policy. Once you have a policy, then the security industry can step up and help. Now, if you have any secret data, whether that be data that's covered by the Privacy Act, or any number of the, I think there's about 30 different amendments. Each different one is different for every state. It's a nightmare in Australia, and it's not looking to us in the security industry at least like we're going to come to a great standard on this anytime soon. So there is a lot of value in looking at overseas policy, but only from a policy perspective. At a technology level, it's useful, but you've got to be very careful it's applicable to local law and local regulation. Really, really critical. Just because something's HIPAA compliant probably means that it's got a lot of filters built in for medical terminology for particular fields of data, but it's probably not going to have stuff built in specifically for this region and looking for those very important Australia-specific bits of data. For example, I could buy a software that says, all right, I'm going to pay HIPAA compliant for data privacy, and it's going to stop anyone's social security number going out, which is awesome, because no one over here has a social security number, and it's not going to help you. Now, we'll look for other things that are really relevant. So putting a tick in the HIPAA box is super valuable, but I need something that understands who I am and where I'm from. So looking for Medicare numbers is much, much more important. At a big company, big hospital level, most of these guys have a team of people in place who understand what that's all about. They're really, really good at doing that. And there are 5 critical steps that you really need to take, or 5 bits of technology you need to have in place to stop your private data leaking out. Without those, you're in trouble. Now, for most little people, and most little organizations, perhaps I'm getting my startup off the ground and I'm not cash flow positive right now and putting my own money in, that's a challenge for me. I don't want to be spending $1 million on technology for my startup that isn't actually building anything yet. I've got data, it's really important. I've got my secret project that I don't want to leak out, but I don't have $1 million to spend buying some mega company solution to stop all that going out, because I'm not building $1 million in revenue yet. So there's a happy medium in between. The danger if you do nothing is, it could be like, I don't know if anyone read the news a while back, no one's publicising it anymore, but there was a Queensland medical practice got hit by some ransomware. Do you want to know what ransomware is? So a bit of software gets on their system, locks everything down, which is probably the best outcome for this deal. But it encrypts it with military-grade encryption, There's no breaking the encryption. It's a fantastic level of encryption, a very, very clever way to make money, and they charge you some money to unlock that tech. Well, these guys had to pay. They had to pay quite a lot, and they just had to suck it up. When they were asked for a quote, their IT guy said, "Oh, we have all the antivirus stuff in place, so it would be okay." But they're not looking, they're not treating it as a serious risk. And if you don't understand the potential for damage, then that's when you get in trouble. So just because you're a small company and you don't think your records are of value to anyone, doesn't mean you're not going to get hit. Right now, in my industry, we're in the middle of a massive epidemic of ransomware. There's a viral Trojan doing the rounds. It's called CryptoLocker. I don't know what it's used. CryptoLockers everywhere. And companies that we deal with who are high-tech companies who spend a lot on security are getting nailed. And they're mostly getting nailed for stupid things. But the reality is this program is making money. And programs that make money spawn copycats, and the money gets reinvested in development. People run this like a business. So it's not a bunch of uni kids in a back room writing some software and hoping to nail you. These are professionals who understand what they're doing. Now, they're not charging a lot. The good news is if you get that on the crypto locker, probably only going to get charged $300. The bad news is once you've been hit and you've decrypted, being able to get every trace of this on your system and never get hit again is really, really hard. Even for guys in the industry, it's very difficult. If I got hit, I would put a drill through my hard drive, throw away my data, and start again. Because I could never be 100% sure that I was going to be okay. Right? So because these things are making money, we expect this to be more and more and more of that. So I've had a dozen of our customers come to us and ask for assistance to deal with the crypto locker infection in the last month alone. And they're the people who are prepared to actually admit it. There aren't many stories on it right now because no one wants to be that guy who goes to the newspaper and says, "Oh yeah, we got nailed." There are 4 ways your data could be stolen. And there 4 groups of ways, really, right? I split all this down, so I'm not right? There's 4 key threat types. So there's the accidental human loss, and that's I accidentally send you an email full of data, and I forget to anonymize it, and it's a bunch of secret data in our archives. That's bad. It's not the worst thing that could happen to you, but it happens a lot. In fact, 84%, based on US research, 84% of data loss is exactly that. It's a human with no malicious intent doing something silly, and out the data goes. Still just as damaging. It's very, very bad, and it's a big risk. So you need to take measures to protect against that risk. You could be subject to what we call an accidental attack. And what I mean by an accidental attack, there is really no accidental attack, a deliberate attack, but a non-specific attack. So a lot of the ransomware is very much like this. The virus is out there, it's in the wild, somehow my organization comes into contact with it and I'm infected, I'm in trouble. And once it hits me, it starts sniffing around thinking, what bad stuff can I do here? Sometimes it'll be a bit of software that sits on the computer and hangs around waiting for an opportune moment. Sometimes it's recording keystrokes, waiting to see something that looks like a credit card or a person that's identifiable data that looks like it can be monetized. Sometimes it's just sitting there and using your computer systems to send spam and sell Viagra, dodgy Viagra to other people on the internet. Who knows what it can do? There are very basic versions of this kind of software, and there are hugely advanced ones. There's nation-state sponsored programs that record video and audio from any device they can find, including mobile phones. In a medical environment, it's super risky. I mean, you think of the kind of things that a webcam could be exposed to, like a record feed of that. There's all sorts of horrible things that could be done with that data. So bad. There's the deliberate attack on your organization where someone's targeted you, wants to come for you, and they're after your data. That's a very challenging one to deal with. And lastly, there's the deliberate human attack where you've got someone inside your organization who wants to take the data out. It's not malware. It's someone who's decided about enough. Maybe I work in a practice, maybe you're on your own study, and I want to steal your patient list and pull it on up and say, you should come to my practice. Maybe I'm working on your secret project with you, just selling a new idea for the startup, and we got a falling out, and I decided I'm going to take all that stuff. I'm going to take all The data, maybe it's customer data, maybe it's patient data, maybe it's secret project blueprints, whatever it might be. It's a lot more common than you think. In my industry, it's very common for people to steal customer lists. And it's a difficult thing to protect against. If someone really wants that data, how are you going to stop them getting it out? Most people aren't stupid enough to send it from their corporate email. But what if it leaked out by a Gmail or by a chat or an FTP session or something like that? All of these things are risks. You talked a lot about one of the biggest concerns for practitioners is risk mitigation and fear of litigation. If you don't want to get sued, you need to take some basic measures. And to a degree, you need to accept that if someone with enough resources really wants your data, they're probably going to get it. So part of the policy is, what do I do in the event of a major data breach? If someone with the resources and time wants my data, odds are, if I'm using any kind of electronic record, they're going to get it. It's all just a matter of time and money. There are loads of different ways to steal company data. There's a great breach recently. Guys went to the car park of a big company, scattered a bunch of USB keys around, employees on their way in, picked up the USB key, put it in their computer, they're infected. Now, I work for a network security company. I can't help you with that. I can't stop your employees picking up a USB key. I can tell you should educate them, but I can't, we don't run a team of security guys standing tapping people on the shoulder saying, don't put that in. We can tell you the good policy might tell you if you've got really secret sensitive data that can really do harm, it might be a good idea to lock down the team for it. Policy. No technology can help you against that. What technology can do is give you that buffer and protect you for the broad brush stuff. The very targeted action, have a policy and be prepared for what happens when a breach happens and know what to do. That's not something I can help with. What we do is we say, if an accidental loss was going to happen, how do I stop against? How do I prevent against that? Now, in most cases, the big companies are spending literally millions on this, right? So they're fingerprinting all the data, they're working out where it goes, they've got the policy in place. Most startup organizations can't afford to do that. So what we suggest is that you take a simple and extensible approach to data security. So find something simple that combines a bunch of services together and do the basics for it. If you're a small company, you may have 3 or 4 people, it should be easy to create a policy that everyone can comply to. Then all you really need to do is protect yourself against accidental data loss. And the most important thing in those circumstances is to know what's going in and out of your network, because that's where an accident's going to happen. It's going to happen over email, it's going to happen over a chat session, even someone posting on Facebook update can be disastrous. So what you need is a simple way to identify the data that's important to you, whether it be patient data, credit card data, or part of your the secret project or your own customer list that you're working on. And there are means to be able to do that. We produce devices that scale right down into the few $100 range, and they scale right up to the big multi-site hospital that do exactly that. So we combine all those services onto a single platform, and it's looking for specific data. So it's sitting at the edge of your network saying, all right, no viruses come in, no spam come in, no strange connection attempts come in. And then the other way, it's saying, all right, no weird connections from inside out. So in the instance that I've got that USB key and I stick it in my computer, and maybe it's sending spam, maybe it's sniffing data and trying to send it out. I need something that looks for that and says, don't send it out. I also need to know that bulk Medicare records aren't going out. So I don't want large, with lots of credit card numbers, lots of driver's license numbers, lots of patient data. So really important to be able to do that. So I would say, in a lot of circumstances, you need to start small. You need to understand what data is important, build a policy, and then get something at the edge that will allow you to understand what's coming and going from your network. Really, really critical. If you don't understand what's leaving, you're never going to be able to stop the stuff you don't want to leave from leaving. The very, very simple stuff. As I mentioned, there are 5 critical services that kind of everybody needs. And what I recommend for the small business operator is that you try to collapse those into a single device. So you need a very basic firewall between you and anything connected to the internet. If you're running cloud services, you still need a firewall. People on Amazon will help you and tell you what you need, but in most cases they'll stand back and say, we're giving you infrastructure or we're giving you a database. It's your responsibility to filter the data that goes between you and us. So you need to take charge of that. If you've got data that's in a foreign country, you need to understand what country that's in and talk to your host about whether or not there's any issues with foreign discovery rules. What I mean by that is ignoring your own organization. If I'm hosting my data with Amazon Web Services and it happens to be in Singapore, am I sure that the Singaporean government can't step in and say, all right, we don't like Amazon at the minute, we're going to take all that data and see through it. And if there's a chance of that, what measures do I have in place to protect against that? All the hosters have tools that protect against that. Very easy, but unless you ask for it, you're not turning it on by default. So we need firewall, we need antivirus, really easy, right? Every desktop needs antivirus. We need something called intrusion prevention, and that's the stuff that says someone's in my network, they're trying to bust out, or someone's trying to break in, how do I stop that from happening? We need URL filtering. All that is saying what websites you can and can't go to. You'll be surprised what basic URL filtering will do to protect you from infection, but if nothing else, you've got a system that's connected to the internet. You don't want the chance that while someone's in your care, they're looking at stuff they shouldn't. So both enforces safe policies, so I don't really want my staff members cruising through porn during the work hour, and if I'm looking after minors, I don't want them cruising past something that they absolutely shouldn't, or I don't want them on a system where they can get exposure to something on my network so I have duty of care. But I also would like to stop people going places where they might get an infection. The internet is it's a fantastic tool, but it's a source of some pretty horrible stuff. So some basic filtering is a very good thing. And lastly, some application control. So allowing me to understand what applications are running on my network, what I'm going to allow. So even if I let people take their laptop home, what I don't want is them installing every which application they can find and allowing them to run it all on my network. That's when people start punching holes in security. So the message I want to leave you with, and then we'll throw open to any questions if anyone has me, is most of my industry spends their lifetime telling everyone that it's way too hard. And there's this whole idea, they call it, the acronym for it in our space is the FUD, that's for fear, uncertainty, and doubt. I don't know if anyone else uses the same acronym, but it's something that the security industry as a whole loves. They want you to feel like it's all too hard. They want you to feel inadequate. And it's not a good thing. And what the general message that we try to put out is to say it's not that hard. You just need to know that you need those 5 things. Put them all in one place, make it easy, get someone who knows what they're doing, get a good policy in place, and you'll be okay. And you know what? If you do get attacked, you can at least go back and say, we've had a strong policy in place, we've had technology in place, which reduces your liability significantly. If you can show you took measures, you're not going to get sued. You have to have a policy, you have to have measures in place. If you have those things, you're going to be okay. You need to allow for the fact that a breach will happen at some point and have a policy in place for that. Because at the end of the day, people are very, very good at busting out of any security measure we can think of. And we have loads of different ways that don't involve the network. But if you've got those things in place, you'll be okay. And they don't have to be $1 million, right? You need something that scales right down, but can scale up. You also need to be a business that's a startup company that is right on the cusp. When you do get that $1 million order, you're going to be thinking, I need to look after this hospital, this research institute, this pharma company. I need to get on the front foot with those guys. The last thing in their mind is going to be security. So you need to make sure you get something that can scale with you as your business grows as well.